ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਜੀ ਆਇਆਂ ਨੂੰ। ਮੇਰਾ ਨਾਮ ਹੈ ਹਰਲੀਨ ਚੌਹਾਨ ਤੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪਹਿਲਾਂ ਦੇਖਿਆ ਹੋ ਸਕਦਾ ਹੈ, ਪਰ ਅੱਜ ਮੈਂ ਤੁਹਾਡੀ ਮੇਜ਼ਬਾਨ ਹੋਵਾਂਗੀ। ਅੱਜ ਦਾ ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਹੈਗਾ ਤੁਹਾਡਾ ਸਿਹਤਮੰਦ ਬੁਢਾਪਾ ਤੇ ਉਸ
and we'll talk about that. So, before going forward, we'd like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, and Tesliwuta peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of these lands. As I told you, I'm your host, Harleen Chahan. I'm a pharmacist. And let me tell you about digital medication. What does it iCON mean? It means intercultural. We are associated with the University of Digital Emergency Medicine. What is our purpose? To assist multicultural and indigenous citizens, patients, and caregivers, and the community at large about chronic diseases, to help them. And if you're living with somebody who does have chronic diseases, we can help you with that, how to take care of them. We also want to tell you, in the age of internet today, that what you're reading there in news or on YouTube, that all that information, how you should look at it, does it belong to you or not, and you should trust it or not, and what things you should not trust. And last of, we want to tell you that about our healthcare providers, the people who provide you healthcare, and yourself, how to have a good communication between them and how to improve it. And that's example today. And we are here, your caretakers are your speakers today, and you can ask them questions. We will start today with our opening remarks.
Thank you for the opportunity to provide opening remarks at today's Strengthening Health and Wellness as We Age forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health, and I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land continue to this day. The Ministry of Health's Patients as Partners initiative believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by our motto, "Nothing about me without me." Patients as Partners has collaborated with and funded iCON for about 15 years with Dr. Kendall Ho as the executive director for all of this time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they want to learn more about. And today, that is about how we can stay resilient and as healthy as possible as we age. As we age, the risk of being frail increases. However, getting older and frailty are not the same thing. By taking a holistic approach to health, you can stay healthier longer. For example, Cardiac BC states that about 90% of premature heart disease can be prevented with good health practices. Additionally, a recent study by the U.S. Centers for Disease Control and Prevention found that the evidence demonstrates that the strategy of self-management and educating ourselves achieves desired outcomes in multiple chronic disease contexts, including diseases of the cardiovascular system, diabetes, asthma, and arthritis. So there's lots that we can do. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on self-management, eating well, staying active, building resilience, and many other topics. There are websites where you can enroll in self-management, health coaching, and other peer support programs that provide information, skills, and support to help you achieve your health goals. Some of these resources and programs are provided in different languages to make them more accessible. Also remember that encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to express a big thank you to iCON and our presenters. I appreciate your time. I want to thank everyone for attending. What you do for your health can make a big difference. Thank you. Have a great session.
This was from the Ministry of Health, a couple things. The things that she said that I want to bring into your attention that my health is in my hands. Otherwise, there is no health. So what you can do with your health and to decide to make judgments about your health.
Now we will talk to how to plan ahead, planning ahead and accessing support for our next speaker is Sarb Basra. She's healthcare social worker of Fraser Health Care. And palliative care means when the last moments or months or days of your life, she works with that team. Sarb is a master in social work from UBC. Her mother had advanced Parkinson's disease. In December 2023, she passed away. Sarb was the main caregiver for her mother, and she's a healthcare advocate for so many other issues. She can help you with that. Sarb, in her personal life and through her profession, she has a lot of experience. And to talk about all that, what are the things that are happening in healthcare profession, especially in our Panjabi community, and which are beneficial to us in healthcare. She also wants us, if there's anything in healthcare, if we are feeling fine, or go there, or should we go there when we don't feel fine. For both these times, you should get the care that is beneficial. And now I welcome Sarabjit. She should come and tell us about her talk. Greetings to all of you. I was watching in my evidence, some are sleeping, some are falling asleep. I hope, greetings, my presentation, my uncle is here. Greetings. The information I'll provide today, it will be extensive information, but we have limited amount of time, so I have to talk faster. So please forgive me if I make a mistake, but I hope that this information will be helpful to you. Okay. First of all, what are our objectives? We'll talk a lot about how can we make decisions as you age, and financially and health directives that we can prepare in future, and access community resources. I will provide information about that, and explore support resources for caregivers, and perhaps for your family, and your family is helping you. So I'll talk about those resources. We have already talked about it, and this is my photo of with my mom. My mom's name is Jikinder Kaur Basra. As Helene told you, my mom passed away in December 2023. She had advanced Parkinson. She was 61 when we learned that she got this advanced Parkinson, and she had diabetes on top of that, and anxiety, high blood pressure. It happens in our life. We see that. Many people have that. In 13, 14 years, my mom had this ailment, and first she was fine, and gradually it kept changing. Because the disease of Parkinson, it affects your whole body, and it changes many things, and we become dependent, to even take care of yourself. As Dr. Sohi explained, and Helene too, and Dr. Jane as well. When we have this frailty, it affects our whole system. And as we were talking earlier today in the presentation, I have seen it all in my mom. And on the other side, from healthcare social worker side, I have seen many patients. I have worked with many patients and families, and I have seen changes in them and the problems they face. So I can understand it from both sides. First of all, I wish to ask you, how do you decide things in your own life? Sometimes we think what is in our hand. My mom used to say that you have to become your own doctor. That's why you're here. You understand that, to get the information, to learn how can you take care of yourself. My mom used to say sometimes, and we go to the clinic, we see the doctor, nobody listens to us. But she wouldn't tell them. And I would go with her, and she wouldn't listen to them. She kept talking. And when you go to the doctor, do you feel doctor or healthcare professionals, they're not listening to you when you tell them about your problems, your ailments? Maybe you feel it. I want to ask you as well, who agrees and who can tell me? And sometime you don't listen to them. You just keep telling what you want to tell them. And the doctors and professionals, we don't listen to them. What are they suggesting to us? In every religion, you learn so many things. Some people believe in a religion, some don't. And it's your own perception, your opinion. And if you, in the Sikh religion, if you listen, you can read it. With your own hands, let us resolve our own affairs. What is in our control? How do we decide things? Sometimes we leave it to the God, and God is doing it to me. But sometimes there are things we need to decide that we don't take. But even the scriptures, they teach us that whatever is in our hand, we should do that. We should take responsibility. And if you listen to scriptures, there are other things, and it gives you some guidance that it's in God's hand. It gives you guidance in your life, how you bring balance to your life and peace, and the decisions you make are God's will you accept, and how do you accept it. And if you combine those two teachings, you can understand that there's a fate. If you believe in fate, and sometimes there's so many things, it's in our hands, and like healthcare system, our family members, their behavior, things like that. And then you can also understand that, taking responsibility for your own things. That's your own responsibility to take care of yourself. The graph I made here to understand that in your own life, there are ups and downs in your life. Even in your health, there are many ups and downs, up and down, up and down, as you can see it. And we can see, and you can put time here, and health, and our life goes up and down, normally. And you might have seen, and sometimes, or many times, with time and age, there are many changes, and gradually there change. So many things change in your life over time, and you see a gradual change. On the other side, you might have seen, and sometime our health is fine, and then all of a sudden it changes. We can have stroke, heart attack, accident, cancer. There's so many things, that can change.
So sometimes we don't know what is what will come, what the life will bring it. So we try, but you can resolve things by yourself. You can manage things by yourself. Try self management, because you can only see the doctor once in a while. After 3 months, 6 months, after a month. Sometimes there are so many doctors. So try yourself. Try self managing everything, whatever you can. Now we will talk about health system. The health system is like a machine. There are a lot of aspects of it. There is something provided by government from Canada, from BC, funding, programs. That's their responsibility. And then that's the outer part. Inside are the inner part is the doctors, their responsibilities, and then you say, then there is patient and family, their responsibilities. If we see the overall system, if everything is going well and keep on going well, if there is any shortcoming in any system, then that give rise to too many problems. Maybe it's your experience when we are in the health system, or like we see our family doctor, or you go to the hospital, or you go to a clinic, and sometimes we have a very good experience, but sometimes we face problems where we think nobody is listening to me or understanding me. There will be challenges. We can face challenges. For example, people who don't speak English, there is a language barrier, language problem. Now in Fraser Health and other health authorities, now they are using a lot of interpreters and translators. But in small towns or in some areas, there is no facility like that. There is no resources like this. Sometimes there is a problem with education. People who are not that much educated, or there are a lot of use of medical words, they are unable to understand those words, because we don't have these and this understanding like what they are saying. So it's for hard to understand. Sometimes we don't have a full understanding. On top of that, we feel shame. That's a stigma to us, that we are always. It's always a challenge, like the respect, shame, that I'm not gonna use that. I'm not, what people will say, what will happen if I go there. These kind of challenges and above all we have fear, like what will happen to me now, what will happen in the future. So these are the challenges and problems. And above all, you might have experienced that you hear a lot of different information. Sometimes this doctor is suggesting this, the other doctor is suggesting this, and the third one is giving a different suggestion. So we are hearing different information, and it's hard to understand, and we get confused. So sometimes we are in a situation where we feel helpless. Sometimes we are in those situations that we think we can't do anything. Whatever has to be done, doctor will do it. What are the doctors are saying, we don't know. So we don't know what to do. Or we can think what is in control, what is in my control, when we don't know what will happen next. In this situation, I can help myself. I should help myself. I should take care of my health. I should ask more questions. I should gather more information so that the doctors can talk to each other, so that I could get a clear instruction, so we can self manage also. And we also can say is our health is like a garden. So in future, we're gonna grow garden now. Whoever is at home, when we garden, start the gardening, what we plan, what we wanna grow, like radish, chilies, whatever we make a plan where we wanna grow carrots, what vegetable need more shade, or need more sun. So we plan everything, a lot of things. And after that, after growing, we see whatever um, what changes we need to make, which need more plant need more water, which plant need more sun, all these kind of things. We have to see what we do now. We have to plan what to do next. So whatever we think, first of all, for our mental health, so we should that I can do it. I have the courage. Whatever I think, I can take steps. I can take steps. I can do it. I can learn what are my main objectives, how I can achieve those objectives, how can I take care of my health. So this picture is when my mom was in a hospice, where our patients come. This is my picture with my mom when they was in a hospice. And see, taking care of your health, we have to make a lot of health decisions as in our life, like making food, going for groceries, many other tasks, go to India. So there are so many decisions in your household you make. Similarly is the health decisions, when to do what, who will be helping us. Is it you yourself doing, making your decisions, or your family will be helping making your decisions. So like other decisions, same are the health decisions. When we go to doctor, or any other healthcare professional, so they look at things different way, how we gonna make a decision. So what is the problem, which ailment we have, how we can treat them. We should think about the disease, the treatment, we think about the benefits and harms. So we weigh them, and then we make a decision by weighing the benefits and harm. And then what will be the benefit of this decision, or harm, or how it will affect me in future. So you have to weigh things. So in your situation, in your family, for your health, is what is most important to you. So some decisions are known, some what will happen, and if you have a little bit of headache, so sometimes Tylenol is good for you and you take it. So we know, so most, yeah, so the chances are the headache will go away, but some decisions are unknown. We don't know what will happen in the future or what will not happen in the future. For example, knee surgery, you take it, you know if the surgery will be successful or not successful. So maybe like eye surgery, if it will be okay, successful, or for example, dialysis, it will support you or not support you. So maybe there will be a benefit or there will be a harm as you age, as you get more ailments, you don't know how, what it will bring to you. So then it links with like in our life, how we plan, how we decide. So you have to plan. We call it planning. So there are different plannings like regarding financial, healthcare. There is estate planning. I'll talk about it more. What is advanced planning? Basically, in the family, we speak to the family who can understand us, but normally I see sometimes we are not comfortable feeling. It's the comfort level. Sometimes family doesn't feel comfortable to talk about it if you are unable to speak and due to your serious situation you are unable to speak. So we talk these things in emergencies. So sometimes we are not in a good thinking situation. We are not in a decision making situation. So the people who gonna decide for you, they don't want to decide it for you. So there are a lot of issues like that. So what we can do is, when you are unable to communicate, so you can make legal documents. So there's come under advanced care plan. So you can substitute, you can give that authority to your family member. If I am unable, I am not conscious, or my mental health is not in the position to decide for myself, then you can give it, you can sign some family member that will reduce the stress and you will be at peace that someone is making a decision for you. So in your life, you have to plan. You might have heard these words in your life. And if you like your estate, your will, you can make a will, you can make a power of attorney, life insurance, and other financial planning. As you can go to a notary public, so or a lawyer, you can prepare all these kind of documents. So I have touched the main topics, key facts, and above all, we also say it we call it a representation agreement. So regarding decision making regarding your health, we most of the people don't do it in their lives. So most of the time, your lawyer, your notary public, you make when you make your power of attorney, your well, so also make when you make a representation agreement, if you give the authority to someone, if I become unconscious or I'm in a situation where I'm not well, I authorize you to do decision making for yourself. So in those documents is written what are your decisions, and if you are seriously or terminally ill, then these documents come in effect, and then they go through the documents and go it that way. When you do make these documents, think about your health, your age, what are the benefits, what are the harms. Think about it. Think about your health. So prepare all these documents. So share these things with someone in the family. Sometimes I see, even if we sometimes we don't make the documents, we didn't talk about it, Then when there is an emergency, then we look at each other. What to do? We didn't talk about it. We didn't prepare. We didn't talk to the dad about it. We didn't prepare what we do now. So so these kind of problems become bigger sometimes. And then with the doctors, communicating with doctors and family, so talk about these things in advance.
Now I will briefly talk about the caregivers. We call them caregivers. Like I was a caregiver for my mom. Perhaps among you, some partner is going to help your children or other family members, and they are other family members, or you're looking after somebody else. They're talking about their responsibilities. We'll go back. First of all, there are so many responsibilities we have: food, preparing, shower, dressing them, and taking them to an appointment, and other events that we need to, grocery buying, and other work. And then you look at talking to the doctors, going to a clinic, hospital, and there's so many appointments that you need to prepare the medication. They're dancing, as you see. Sometimes you go to a party or go to the temple or other places. There are other events or days that you need to go, or many things you need to do at home. And we also have these responsibilities. And looking after our children, our family, so many, activities you need to do, any other medication that, you need to spend money on, and household chores, and sometimes somebody needs help at night, and other family chores, responsibilities, socializing, visiting relatives, and also work. We have to look our own profession. We have to make a balance. And all the healthcare workers, and talking to all of them, and staying in touch with them. There are a lot of responsibilities. And there's a patient that you're looking after, a family member, and then the caregivers sometimes also have so much stress. And if it goes on for only a little while, we can all do it. But if it goes on for a long time, many years, it continues, it can affect our own health as well. And we can get some of these ailments. Sometimes, our diabetes or sugar goes up, blood pressure goes up, and we have so many stressors in life, even though you want to help, but sometimes it's hard. And sometimes, you get angry and you are distraught, and some family member is saying something, other one is saying something else to take care of the person this way, that way, but they are not helping you, and it creates so many tensions or stresses in the family. And people who are looking after the caregivers, and sometimes it creates a lot of stress in a family, and affects your mental health as well. And we are busy with our own life or work, and sometimes it can create depression. In Fraser Health, I'm not sure about other places, but in Fraser Health especially, It's been 3-4 years they started this program. We call it caregivers program. And these are social workers. They can teach you about the system. They help you provide counseling. And your personal experiences, they talk about that. And they provide you a lot of education. And as we have already talked about this, and about our mental health, if you think about it, if it is in our hand, talk to others and get information regarding your health and actions you need to take and objectives, you think about those. And about health management, it's not easy. We know, I know with my mom, we spent so many days. It was hard. Nobody can understand it. And people I have worked with and situation we had, it's very different. And there's so many other families. And day and night, the problems you have, the pain is not going away. And they're not getting facilities they need. And sometimes there are good times, and sometimes it's hard in our life. So it's can affect our mental health a lot. It's also our emphasize that if we can look after our health, and we can live a good life with our family, that we can spend longer time with family. And I'll tell you some of the services that are available. The resources are in your package. There's a lot of information there. And you can check in your package. There's a health link, 811, where you can phone. And in 130 languages, they can talk to you, whatever language you use. And there are nurses there, dietitians, exercise specialists, and whatever ailment you have, you can ask them. And there's a 211 phone service about the resources in your community, their program for the seniors who live alone, and with the lower income, what service they can provide them so they can live there. And then there's a Fraser Health home mental health crisis. Home health programs are there. And the nurses that come to home to give you shower, change clothes, take care of nursing homes if needed. And there are communities resources that are available. Seniors Advocate website is there. They have put a lot of information there. Social prescribing, like recreation programs in the community, transportation programs I'm talking about here. And they can link you with those. And if it is putting a lot of pressure on your mental health, and in the Fraser Health, there's a mental health crisis line. And if there's a more if there's any other problems, you're thinking about suicide or crisis, and if you have all those problems, you can, there's a Canadian number there. And there's a Seniors BC, that's a good website as well. All these resources that are there in your community. And in Fraser Health, there's a virtual care clinic where you can phone and you can tell them about your health, and they can give you some guidance. Handy Dart, Taxi Saver program, and then they take you to the appointments and somewhere else, and then you get coupons from the transit, and there's a Taxi Saver program, and then there's handicap parking stickers, from the Spark agency. You can get it from the farm. And if you know, there's a Canadian dental care plan available to take care of our dental health, and then there are food banks that are available. The people who use it, and all this information is there. 811, and people who have risk of falling, and they have provided information there, and how you can look after your own health, especially family caregivers of BC. Information is there to assist you, and then Pain BC. If somebody's having a lot of pain, and there's education programs there, and resources available. And last speaker of is self-management. They'll tell you about that. And I hope the information that I have provided you today, it will be helpful to you. And thank you very much.
Okay, we start questions. First one is about bones and joints. Is for Dr. Sohi. Two questions. If your bones start growing, what you should do? The second is if in your joints or in muscles, if there is stress or breakdown, what are the regions and what can we do for that? First of all, we talk about the bone. When the bones are weak, frail, we can see with the test. It's called bone density test. When you do bone density test, if the bone is weak, there is a level. First level, we call it osteopenia. So where we live, there is not enough sunshine. There is a vitamin D deficiency in the community. Where if there is a deficiency calcium, vitamin deficiency, vitamin D deficiency. So the first step is you you should increase calcium and vitamin D to protect your bone. So if they are more really frail, when you reach to the stage of osteoporosis, that means in the bones you can think about they are rotten, they are very frail. Then for that you have to take tablets and other medications that can help the maintain the bone or regenerate the bone. And so you should, if they are going down, bone density test, talk to your doctor. So he will, if you are on the first stage, if they are really weak, vitamin D and calcium is needed. You need a prescription for that, and we can help you with that. Whatever you do to protect bones, exercise. That means which exercise? Yeah, so the one that can stress your bone. Walking is good for your heart, for your breathing, but it doesn't do anything to your bones. So the exercise that were shown, and they will show after in the afternoon for your bigger muscles. If you put some load on those big muscles and bones, so that's how you can address the frailty of bones. The second question about the joints. As you age, the joints, our joints, and it's arthritis is common problem in our joints when we age. It's called osteoarthritis. When it starts, for that arthritis, we can't do much with that. But the joint and the muscles related to that joint, up and down, for example, your knee or your shoulder with arthritis, you have to make your muscles strong, like your shoulder muscle, your arm muscle. You can decrease the pain you can lower the pain. You will not need that much medication for that. You can apply creams that lower the inflammation. You can lower the pain with the creams or exercises. Sometimes when the pain is severe in the joint, then we have to replace the joint with the surgery. So in the early stages of that pain, we can refer you earlier when the pain is severe. Then you make a referral, then waiting list is long, the surgery takes 2 to 3 years, then the frailty kick in because you are not using that joint, so you are not walking that much because the knees hurt or your muscles are weak. Then so what can we do with the muscles? You ask this question. Exercise, as I told you earlier, and protein in your diet. So these two are the main important things. If you are 70 kilos, if you are 90 kilograms, so the minimum you need is the 70-gram protein in a day if you are 90 kilo. So more protein you take, your muscle, it will help your muscles. When you exercise, your muscles get a good stress, and with that they are strong, and with age they decrease, and we can stop it from progressing. Next question is unnecessary bone growth. It's the same mechanism like arthritis. When your joints, when there is a breakdown of calcium and calcium deposit in your bone, whatever space there should be is called grease too, is fluid in the joints. When that fluid is nice and smooth, and then it's the joints are spinning nicely, but when that extra deposit is there, then they are not that smooth, and then it doesn't spin or move nicely smoothly. So to stabilize the joint, those bones, you cannot remove it until there is a surgery, and the muscles around it, you can make them strong and you can stabilize the joint. So the issues in the joints is usually gradually increase over the years. In the beginning, you are exercising, stabilizing the muscles that will strengthen your joints. Your question, you wanna ask more? Lunchtime, Gurmeet Sohi will be around. You can ask her that time. Any personal question you are asking, remember, she's not your healthcare provider, so they have a license. Everybody has a professional license. She has a license. You can ask general questions. Don't ask liability questions. So especially some of the things we can't answer. We don't have your history. Please remember that. Your family care provider can tell you most of it because they have the history. We don't. We are not your healthcare providers. Please ask questions, but general questions. There are line of questions. You write your questions. You can write your questions. Please write. There is a line.
1200 milligram calcium in a day that you can take. Some people take calcium pills. It's fine if you're not getting it as part of your diet, but that can create constipation. But otherwise, you can take 1200 milligram calcium vitamin supplements. If you're not aged, but you're still not getting a lot of sunshine, you can take 1000 unit of vitamin D. If you have a kidney disease or knee disease, that your calcium intake is different. If you have kidney disease, it can be different. You can ask your doctor about that. Next question is about social work. You're a representative of social work. Both questions are same type. They want to ask if somebody's in your home, they need a placement, they need a care home, and you can't look after them. How to do it? Can you help with that? If you can help, how to contact social worker? There's some information that was provided in the package as well. Bone Health Service line, you can call them in the Fraser Health if you are in the Fraser Health area. And they'll do an assessment. And they'll look at that if your family member is suitable for a nursing home or available for home sport, if that facility is available or sources. And usually they start with that. And if that is not helpful, then they look at a facility, if you qualify for that or not. But it's also that worth looking at if your family member is, if they want to go into a facility or not. Because if their memory is still good and they don't want to go, you can't really force them to go there. As my mom's condition was, she would never go to a nursing home, even in her last days, when she knew in hospital that my health is not well, that perhaps I have to go to nursing home because it will be really hard at home. And then she just lost her courage. Even then, we tried to convince my mom that we are not able to care for you, and you get tired as well, and there are so many responsibilities, but she didn't want to go to a nursing home. Then we couldn't force them. But if mental ability and your memory is losing, and the doctor is saying that this person cannot make her own or his decisions, and you are unable to care for them, then they can decide which care home is better for them. You can talk to your doctor or home health care. Next question is for me. And people who are here on super visa, can they see their pharmacist or prescription? And let me tell you what super visa. There's a clause in your super visa insurance if you know somebody, and read that clause. If you have a BC Care card, and even in a super visa, if you have a BC Care card, those resources are available to you, which are available to BC residents. If you go to see a doctor, there's a fee available that you have to pay. If you need to ask questions from your pharmacist, and if about the medical review, if that's covered or not, perhaps it's not covered if you're not a BC resident. It depends on your care card, and it depends on your MSP. Right. Next question. It's the same. Again for Dr. Sohi. Dr. Leena Zain is not here. Dr. Sohi will help us. 2 questions. First of all, if you can tell again, dementia and Alzheimer, what's the difference? And if you spend more time on the phone, and can you get dementia? First question, if you think dementia is a general category, and dementia has many types, Alzheimer is a type of dementia. If you have Alzheimer, that means you have dementia. And some people might have dementia, but it's not Alzheimer type. It's different. Dr. Jane explained that. If you have stroke and your diabetes, sugar, and blood pressure problems, it affects your brain differently, and it can decrease your thinking or cognitive abilities, vascular, and if you're Parkinson, you can have dementia due to that. There are different types of dementia. Alzheimer is usually short memory, what happened today, yesterday. You start noticing that earlier. And when you see geriatrician, you ask them many questions about thinking, about your family, what they saw, and then you do memory tests, and then you can figure out what kind of dementia you have, Alzheimer, or any different kind of dementia. Some people have it mixed. In our community especially, have diabetes problem, heart, stroke. And some people, Alzheimer, vascular, they get the same, that dementia at the same time. And when we see you, we can diagnose that and what to do next. The next question, that's a very important question. That our phones, TV, when you look at it, when you're sitting, you're not actively using your brain. YouTube, WhatsApp, videos you're watching. As you're aging, I'm not saying that it can lead to dementia for you, but it's a risk factor. Because you know two things. There are two things that can decrease dementia risk, hearing and medical issues. One is exercise. If you do exercise and your brain cells are fine, they remain strong. Other is socializing. People who spend too much time on the phone and they don't pay attention to new interest, and that starts the weakness of the brain. It starts faster. If I can say, exercise is really important, and to learn new things. And if you socialize, see other people, you talk to them, you learn something, and you use that brain in that setting, there's no comparison to that. So use the phone the least amount of time, watch TV the least amount, go for a walk, exercise, spend time with friends, family, kids, and spend more time with them. It's beneficial. Next question. We have only a few questions. I know we have lunch coming up, so we can eat. Next question is pharmacist. I can answer that quickly. Question is how you can arrange a meeting with pharmacist. The pharmacy that you go to, you can book an appointment with the pharmacist there. You can talk to them about your medication. And the pharmacy that you usually go to, where you get most of your medications, you can make an appointment there. And I'll be here at lunchtime. You can ask me personally. And if you have allergy with the changing seasons, antihistamine or allergy medication, can you take? Can you take it all the time or as needed? You can do it both. If you have allergies all the time, you can take those allergies medication. But which medication you should take, you should ask your pharmacist. Some medications that can increase your blood pressure, your sugar level, make you sleepy. Which antihistamine you should take, you can ask them what conditions you have and what's the best for you. And if it doesn't help, there prescription medication available as well. You can get it from your doctor. Yes, you can take it, but just be careful what interaction Next question, the last question is for Sarb. What is Taxi Saver and how you can get it? Especially here in Lower Mainland and in other areas, the service might be different. Taxi Saver program is, it's through Translate, you have to register. It's called Handy Dart. There's so many coupons available that you can get a taxi at 50% off. There's Handy Dart, that's buses. Then you go to the appointments and they're available for you in the community services. And if you want to go socialize to go make an appointment, and there are tickets available. Taxi Saver program, you can get the coupons from Translate, but you have to register with Handy Dart, and you can use it for 50% rebate at the taxi fare. And Handy Dart has many criteria as well, where you can't use the public system, or you can't walk or sit, or you cannot use the normal public system, and you need that service. It's not available to everybody. And I'll just give a couple more suggestions. Secondly, if we have serious illness and we cannot look after ourselves or the person we are looking after, you are unable to do that, there are many financial benefits available through, there's a disability tax credit, and you can get an application through your doctor if you have illness like that. And I just want to give you a suggestion at the end. And right from the beginning, we have so many stressors in life. And now the counseling services are available. And like moving forward, there's a organization available. They give you free counseling or for lower pay. And there are many other services available in the community. I'll encourage you. And, we also need counseling. Sometime in the family, there are so many stressors in life, in our family. And to look after our own health and to seek help is also important. Thank you.